Hey everyone, it's Logan. For the podcast I listened to, it's episode 58 and it was called School Refusal Behavior. So today we're going to talk about that a little bit. So what is school refusal behavior, or SRB? It's a child motivated issue of not wanting to go to school, skipping school, or missing periods or classes, and then slowly just gets progressively worse. It's a fairly common issue of schools today with students, and it's also related to absenteeism and truancy. Absenteeism is combined excused and unexcused absences, and truancy is when I believe it's when parents get in trouble for their kids not coming, but usually they don't even realize that the kid's not going to school. SRB starts usually with kids pleading not to go to school, and then their parents still taking them, even though it's a fight. It's turned into morning tantrums, which then turns into tardiness, into period absences, not going to first period, and then complete absences for days on end. A lot of the research from this podcast was from a psychologist, not somebody who was certified in ABA, but it was psychologist Dr. Christopher Kearney, and he's actually one of the only resources on SRB. His research led to the development of SRAS, which is a school refusal assessment scale. So we'll talk about that just a little bit. It's an assessment tool that's completed by both the child and the parents, and possibly a teacher if necessary. And although you can't find a function from an indirect observation, such as an assessment scale, this was from, I believe, in the 1980s, so it was used to describe the function of behavior. So it talks a little bit about the history of school refusal behavior. It started in the 1920s, which is when they realized that some kids have a phobia of school, which is more just like they're scared of the concept. They don't want to go at all and will not go. Into the 1960s, where they thought, okay, well, we can counteract this with desensitization of the child, just kind of throwing them to the wild, making them go, which then in the 1970s turned to competing reinforcements. So the idea of making home less favorable and school more favorable, so adding more positive reinforcements to go to school. So the SRAS, there were four categories. Category 1 is the avoidance or fearfulness of school. Category 2 is escaping the aversive social situations of school. Category 3 is the need of attention or maybe separation anxiety from the parents. And category 4 is the tangible reinforcements of being at home. So watching TV, playing games, not doing schoolwork. And then it talks a little bit about the treatments for each category. So category 1 is just strictly desensitization of the child, just kind of making them go. Category 2 is cognitive behavioral therapy mixed with modeling and role play to restructure their negative thoughts about going to school. Category 3 is more parental training. So the parents are taught how to shape behaviors using a DRO method, which I think is differential something. It's just basically saying like school is better than being at home, and setting up, restructuring their thoughts. Category 4 is to set up contingency contracting, kind of what we talk about in class. And as defined by Kearney's success, if the treatment works for students as long as they are at 90% attendance for 2 weeks, and as long as they have lessened their levels of anxiety or depression that they feel. So then it talked a little bit about case studies. So first we'll look at Heidi. She's a 9-year-old girl and didn't attend school at all for 2 weeks. She felt she did not like the teacher or the kids in the class. So her parents did their due diligence and transferred her to a new school, but had the same problems. And all of this happened within the same 2 months of school. So they decided to complete an SRAS and decided that a possible function of behavior was positive and negative reinforcers. So the idea of like school is worse than home. She also rated very high on the anxiety scale, and then went in. So for the treatment was multi-step. It was a combination of anxiety management and parental contingency management. I don't remember exactly what all happened, but Heidi was not on board with what was going on and had some issues going into that. And then after they set up contingency contracting with her and made sure she was on board with everything, then she was only missed, I think, like 4 days of the following school year. And then they also talked about Trent, a 10-year-old boy who missed 12 days of school since November. Trent felt embarrassment and anxiety in the classroom because he was inattentive, he had a learning disability, and would pace in class. The teacher, of course, then yelled at him, and then he would leave school and run home to his parents, and his parents let him stay home because they didn't like the environment he was in. So as treatment, they provided Trent with training for his anxiety, social skills training, and also offered parental training. And they decided that the function of behavior is likely needing attention, and they also use attention type things such as positive and negative reinforcers to have him go to school. And I think he only missed 2 days, and I think they were excused as well. So then finally, it talked a little bit about what we can do. Of course, if you're whatever the word is in ABA, certified in ABA. So I talked a little bit about the steps to take. So step one is to assess the SRAS and look at ratings. So parent schools are obviously viewed higher than the child's, and if there's a if there's a discrepancy between parent and child assessment scales, then you have to look a little further. And if not, then they say you're fine and you can just take it and run with it. Step two is to examine other descriptive evidence to corroborate a functional analysis, so use other tests, observations, indirect, etc. Step three is to examine behavioral function to corroborate functional hypothesis. So this is kind of like an ABC chart, kind of the before, during, and after school behaviors, what's kind of causing the function of behavior. And step four is to brainstorm or think of a functional hypothesis for the child. I think that's it. So thank you guys for listening. I honestly picked this podcast because I thought it was more about like classroom refusal, so like not wanting to do the work. I was mistaken. That's okay. Thank you guys. See if I can end this.